All this is Dr. Mobeen Sayed from drbeen.com and Dr. Luffy with me as well, who would continue to advise us as we study today. So, the discussion today is the Pfizer vaccine dilemma. This is not a discussion about being an anti vaxxer, and this is also not a I am not an anti vaxxer, but and then there is some vaccine bashing. This is actually a discussion of the mechanism of antibody waning and a study from the literature of understanding that why does it happen and is it natural and not. There is going to be a question about the vaccine and Pfizer, and do we think that the antibody waning is abnormal? And if so, instead of boosters, do we need to tell Pfizer that they should go back to the lab and create a better product which doesn't do what it is doing? So I'm being a little facetious here. Let's look at it, how the antibody waning works. And Pfizer vaccine is fine. Even when they are saying that, hey, the antibodies are waning, that is really not a problem. And I'll explain that. So let's start our discussion. The Pfizer dilemma. Really important topic. I have no disclosures. Here is a quick cartoon I did. So again, because I have some pain in my neck and the arm, I am doing less drawings for a couple of days. So what I do is I do a little bit of a drawing and the rest is on a slide deck. So my apologies that the standard traditional way of drawing, I am keeping off from that. I am healing, I think, by Monday, I think I'll feel better. Okay, so here somebody like Dr. Mubin is showing a reference, which I would show here as well, for the antibody waning. And there is somebody else who's saying, I swear I'm not able to see your reference. Okay, so let's start. Let's continue. This is also to make sure that we as a family has taken vaccines as well. And here, one of my family members has taken Pfizer. So my older son has taken Pfizer. I have taken Moderna. My wife has taken Janssen, and my younger son has taken Moderna as well. And in this family picture, the biggest disagreement that occurred was about the hairstyle for my wife. So this is the hairstyle she made by herself to say, my hairstyle looks like this. So now that we are on the same page for how the hairstyle is, we can continue. So objectives for the discussion today is we are going to review the immune system's behavior in terms of antibody production and waning, reference for the immune textbooks, immune system textbooks, not studies, not articles, not somebody else's blog. We look at the textbooks to say if the antibody waning happens and if it is natural and normal. Then we'll reference to some studies from SARS-CoV-1 time, not SARS-CoV-2, the SARS-CoV-1 studies, to see if they observed the antibody waning as well, and connect the dots that this happens with almost every infection or every infection and the body's response. Then we look at the references for the lasting immunity for SARS-CoV-2. Some references, I'm not going to go over all the studies. This is not a discussion of the studies. Instead, this is a discussion of how worried should we become with the news cycle, and I'll show you the news cycle as well, that says antibodies wane fast, and then maybe imply that we should go for boosters. And is that really something that we should do? In this process, it may be useful. It may be. Considering the kind of messages that are coming from Pfizer's CEO, it may be necessary for the Pfizer scientists to look at immunology books every once in a while and consult that basic foundational immunology. I may be wrong. They may have the books with them and they may not have opened them for some time. So I would show some books here that can be used. Then we would go over the studies from Qatar and Israel that show antibody waning for SARS-CoV-2 vaccines. And then finally, we'll see if the Pfizer vaccine is a good, robust vaccine, regardless of how the company is positioning it. In my opinion, when the company continues to say that our vaccine keeps losing the protection rapidly, then instead of saying let's keep giving boosters, we should ask the company to say take a pause from giving more vaccines. We can work with Moderna and Johnson and Oxford and others while they figure out what's wrong with the product. Continuing. So why will efficacy drop? So now this is a different question. This is not a question of why would antibodies drop or antibody levels drop. I'm talking about efficacy drop. Efficacy drop is at the end of the day the statistical outcome, which may be because the natural body's response is to reduce the antibody production and cell that are active to kill them off. We'll see that. Or maybe the virus has mutated. We have done this discussion many times that maybe the virus or the pathogen has changed so much that whatever protection we have created is not good at all, or not at all, maybe some percent not good. And that protection may be from natural infection or from the vaccine. That would drop the efficacy if that happens at a community level. Then our immune system may not be working correctly. So it may have become weak. And that could happen at the community level if the community has more folks with problems. For example, let's say a virus that is superimposed, for example, influenza virus or flu virus, superimposed on the current state and making us weaker. Then it may be that people are using some drugs that may make their immune system, for example, steroids and others. So again, it's not the whole community started it, but some people may have it. Some age cohort may have it, and so on. Then vaccine may not be good quality. So you give the vaccine to a bunch of people in a community, and the community's response is different. If the virus is similar, if the people's responses are similar, but still the response is just going away. Again, I'll prove to you that this is normal, natural response. It is nothing to worry about other than a select group of people where the protection is already low, or where protection needs to be continuously higher, because if God forbid they got the infection, and if their immune system does not ramp up correctly and fast enough, and the time during which they're exposed and they have the infection going on, before their immune system comes and takes care of the infection, they might die or they might end up in a hospital. For such folks, it is important to see maybe a booster is needed, regardless of what Pfizer is saying or Moderna or Johnson Johnson is saying. So boosters have a place for sure. So I hope with this objectives, you can see this discussion is not about why vaccines are good or bad, or why boosters are good or bad. It is about our body's response and how to look at current news cycle. So, do antibodies wane? That is the first question that we should have in our mind. That would guide us through the rest of the discussion. So, here I have a book that is Immunology. So, let me open up the book in front of you. I hope they would not be too upset. So, this is a book. It is page number 9. So, let me show you the book itself, the cover. So, this is the title page. 10th edition, Cellular and Molecular Immunology by Abul K. Abbas, Andrew H. Lichtman, Shiv, Pillai. It's a very popular, very good book. And it's a textbook. And in this book, on page number 9, this is page number 9. If you see here, down here, 3%, page 9 of 587. So just page 9, just the beginning of the book. And this is 2019 edition. This was written before SARS-CoV-2 come in. So it is not that these antibodies waning and these sciences are some new science, or they arrived with SARS-CoV-2, or its vaccine is doing something new. Let's look at this. It says here, after the adaptive immune response. So I have skipped all that part of innate arm and adaptive arm because we've discussed it for 18 months repeatedly. After the adaptive immune response has eradicated the infection, right? So I got infected today. Or let's say I was vaccinated, my immune system is trained, then the immune system is going to go to sleep. That is what I'm going to show you. And then the infection occurs. When the virus would come in, imagine now the immune system is going to wake up and respond to it. Now listen, read this sentence here or this paragraph. After the adaptive immune response has eradicated the infection, the stimuli for lymphocyte activation dissipate. So if my body, your body, has taken care of the infection, and vaccine enabled us to take care of infection within a couple of days. Once we have taken care of the infection, the virus is gone, or a majority of it is gone. So the cells that are fighting the virus, they're really not fighting anymore. And so this, when the cells are fighting, they produce cytokines. Plus the cells that are fighting and breaking, these act as cytokines or chemokines or the chemical factors to pull more cells in there. So when the virus is reduced, let's say down to 2% or 3% of its original load, then the same way the cytokine levels will go down too. This is what they're saying here. The stimuli for lymphocyte, that is T cells, B cells, and other cells as well. But here, let's use T and B cell. Lymphocyte activation dissipate, and most of the effector cells die. The active cells that were fighting will die away. This is what is going to happen with the vaccine too. When the vaccine is given, our body would respond to the vaccine's antigen and make antibodies, activate the innate arm, activate the adaptive arm. These arms would work, cytotoxic cells would become active, B cells will become active, antibodies will be produced. At some point, that vaccine produced antigen will be destroyed. When that is destroyed, these cells have nothing more to attack. And now what do we do with these active cells? Do we leave them active forever? No. If that is the case, then from the beginning of our life, every infection will leave active cells in our body, and our body would be nothing but a big inflammation house, because every kind of B and T cell is active. That doesn't happen. So what do we do with these effector cells? Effectors are the active cells. The effector cells die, resulting in the decline of the response. This is 2019 book. If you go back, so I have immunology books here. If you go back to 2003, 2006, 1994, 1995, they would also tell you these things. This is page 9 of the immunology book. So this is not a hugely complex concept which may not be known to scientists or may not be known to researchers. They know it. So here, the effector cells die, resulting in the decline of the response. Memory cells remain, ready to respond vigorously if the same infection recurs. Can there be a more clear understanding of waning? Now, we have to continue to connect the dots here, continue to understand what does this mean. So this simply means when vaccine is given or when the infection occurred, and it's not necessarily SARS-CoV-2, whatever infection or whatever antigen, our body is eventually going to stop responding to it, and the whole effector cell, B cells, T cells, antibodies, their levels would wane. It is normal, natural, and needed. And then if the exposure occurs again, then those cells would once again proliferate. They'll increase in number. Then they would differentiate. Then they would start attacking that antigen once more. And then once they have taken care of it again, they would die again. Important thing here, in some of us, for example, with SARS-CoV-2, we are noticing it. With SARS-CoV-2, somebody is vaccinated. Maybe their immune system did not respond well enough and did not create enough number of immune cells, memory cells. One. Second, maybe they have some risk factors. Their age is such, their immune system is not good enough. For example, maybe they have some diabetes or leukemias or cancers or some other organ transplants, or they're taking medicines that are suppressing the immune system. And now, if they get re-exposure, we are afraid that even after training with the immune systems, vaccines training the immune system, their immune system may not be able to robustly respond. Or maybe for a couple of days when the immune system is not yet responded and it is gearing up, during that time, the virus can really defeat the person's fragility and kill the person. So there is a need for boosters in certain cases, for sure. But this is the normal natural response. So I hope this part is clear. I want to show, there is a diagram here. Look at this diagram. Again, this is a 2019 book. This is now page number 9. Here is a diagram. Antigen recognition occurs. Lymphocyte activation, B cell and T cell activation occurs. If you see here, B cells are producing antibodies. They become effector cells. Then antigen becomes eliminated. Once it is eliminated, contraction homeostasis occurs. Homeostasis means going back to normalcy. Our body would say, fine, I took care of the virus and pathogen and I want to go back to normal. This is the same behavior with the vaccine as well. Then the memory will be developed. The point of the vaccine is to create memory, to train our immune system to make memory, not to be active forever from then on. And then to say that, hey, the immune system has waned, the antibodies have waned. This is not something that is worrisome. Except, again, I'll keep repeating, in those folks where if the immune system has to ramp back up, and that window of time in which it is ramping back up, they cannot afford to stay healthy during that time if they're exposed again, then there is a different discussion to have. So I hope this makes sense. Now, continuing. So do antibodies wane? Yes. Normally wane. A small undergrad level immunology book, page 9, describes it. Do antibodies wane? We're still on the same question. Now I'm going to show you studies from the previous virus, SARS-CoV-1. Just to say that it's, and so then the question becomes, why are we now getting studies that say, hey, the antibodies are waning? Are they doing those studies because they're worried? No. This is a chance for the global research community to pitch in with the research for the same mechanisms that we know, to come back and say, hey, we observed this mechanism with this virus as well. This is a chance for some of them to get their name out. This is a chance some of them to come back and verify that, yeah, this was what was happening and we saw this happening again. There is no difference. There is no problem. And in some cases, they'll come up with the new data, new research, new changes. So the researches are not a bad thing. Our response and reaction to them, the news cycles, the worries, the nervousness, that needs to stay within reason. If we have to be nervous, then we have to be nervous. If we don't have to be, then we shouldn't be. And this is the responsibility of the people who are in leaderships to not misguide us. Okay, so I'm going to now look at these two studies. This is SARS-CoV-1. Look at the study when I'm going to show you. They are saying in this study that I'll show you, they have further analyzed other studies. And in the point number 4.1, they say humoral immunity, that is antibodies, to SARS-CoV-1, not SARS-CoV-2. They're saying IgG against N protein can be detected in the sera as early as 4 days after illness onset. Based on immunofluorescence assays and ELISA, with most patients seroconverting by day 14, IgG and neutralizing antibodies peak at 4 months and then progressively decrease over time. You would actually see the same exact phenomena in the Qatar and Israeli studies. This is many years ago. And then in their 4.2 section, they say, unlike waning serum antibody levels in patients, cytotoxic T lymphocytes responses against the S and N proteins can still be detected from the plasma blasts, which are in the bone marrow, of recovered SARS patients 1, 2, 4, 6, and even 10 years after infection. Make sense? We're looking before the time of SARS-CoV-2. So let's look at this paper now. So this is drbeen.com. This is that first paper, T-cell immunity of SARS-CoV, implications of vaccine development against MERS-CoV. Look at the date, 2017. So it has nothing to do with SARS-CoV-2. They didn't know that SARS-CoV-2 is coming in and this is happening. They were just doing some studies on the past one. And I'm going to this is a good long study. It is an analysis of other studies. A pivotal role for virus-specific memory T cells in broad and long-term protection against SARS-CoV infection has been elucidated. And then they, of course, keep discussing various studies. I want to go here to 4.1 and 4.2. 4.1, I just read that, right? So here it is. And then 4.2, I read this part. And look, they use this comment, waning antibodies, at month 4. Here, look at this. IgG and neutralizing antibodies peak at 4 months and then progressively decrease over time. And then down here they say, unlike waning serum antibodies that they talked up there, levels in patients, cytotoxic lymphocyte response against the SNN protein will be detected for years. And the cool beans who've been here for some time, you know that I've been talking about this for some time. Okay, then going back here. Are there other immune cells that help? So is the antibody the only thing? So this FDA booster decision panel, there were some very reasonable answers, questions in there. One of the doctors said that it is, I'm paraphrasing, I have those discussions somewhere in the articles. I'll see if I can show you. But one of the doctors said, and I'm paraphrasing, that it is unfortunate that we keep talking about the antibodies while the other cells also help. What they meant was cytotoxic T cells help as well. And if they are helping, it's not necessary that antibodies need to be there. Memory cells help as well. And they were saying, if we are trying to prove, which Pfizer was trying to prove, that hey, the antibodies are waning, that is a case to give boosters. And this doctor was saying, if you're really trying to prove that the protection has reduced, not antibodies reduction, protection has reduced, then we should look at the whole body state. That includes antibody levels, that includes memory T cells production and cytotoxic T cells. I would add even innate arm cells. Lasting immunity. So now I'm going to show you some, still creating the context that it is normal for antibodies to wane. Immune system is more complex than just the antibodies. There are cytotoxic T cells, there is innate arm, there are more cells. And then lasting immunity. This immunity discussion here is for SARS-CoV-2. This is for the natural infection. However, I am not in this camp that natural infection is stronger than the vaccine or the vaccine is stronger than the natural infection. You are putting an antigen in front of your immune system and you are adding some adjuvant. Your immune system is going to respond. It doesn't know that it is a natural infection or it is a SARS-CoV-2 spike protein. So this phenomena should be afforded for the vaccines as well. So here, these two, I'll show you the papers. They are saying humoral immunity. So if you start reading here at the green, here we show that in convalescent individuals, who had experienced mild SARS-CoV-2 infection, N equals 77, level of serum anti-SARS-CoV-2 spike protein antibodies declined rapidly in the first 4 months after the infection. So they are also seeing the same thing. The books also say the same thing. The books are written before the SARS-CoV-2 came in, after infection, and then more gradually over the following 7 months, remaining detectable at least 11 months after the infection. Anti-S antibody titers correlated with the frequency of S-specific plasma cells in bone marrow aspiration from 18 individuals. I had actually discussed this study separately. So what they saw was that the memory cells had gone to live in the bone marrow. And those memory cells that go and live in the bone marrow, they live there for a longer period of time. They provide lasting protection. And lasting could be 2 years, 4 years, 10 years, but lasting, longer protection. I think we can expect a similar behavior from a vaccine too, unless the vaccine has some problem. So let me show you this data as well. Here is the lasting immunity found after recovery from COVID-19. This is January 26, 2021. This is on NIH site, National Institute of Health. And if you see here, in this discussion, they're talking about the lasting immunity. Then, here is the one that I just read to you, SARS-CoV-2 infection. This is, what is the date here? 24 May. SARS-CoV-2 2021. SARS-CoV-2 infection induced long-lived bone marrow plasma cells in humans. And then they're talking about that. And I did this a detailed discussion about this study, so I don't want to spend more time here. What is the point of this part of the talk? The point is, even when the antibodies have waned, and when the cells that produce those effects have been dead, our body knows how to continue to protect. It is, in some cases, not sufficient, and there will be boosters needed. But in majority of the cases, our body would ramp up and respond to the infection when the infection would occur. That's the point of the vaccine. So I'm going to skip this part. We know the review part of the immune part of the system. Innate arm activates the adaptive arm. In the adaptive arm, we have humoral response or cytotoxic response. That is the same diagram that I've been making forever. Now let's look at the studies. And now I'm going to give you some news cycle as well. So, and again, if you don't like CNN, if you love Fox or you love something else, that is fine. When I go to a specific site, look at what am I picking from there. I'm not taking their opinions. I am picking people's messages in there. That is what is useful for me to show. So here, CNN, again, if you don't like CNN, that's fine. There is an important thing here, and that is, look how news cycle is handling it. This is, I think, today's report. 2 real world studies today, yesterday, 2 real world studies published Wednesday. Today is Thursday, right? Wednesday confirmed that the immune protection offered by 2 doses of Pfizer's COVID-19 vaccine drops off after 2 months or so, although protection against severe disease, hospitalization, and death remains strong. And then this is their opinion part, saying, hey, even if you're vaccinated, be careful. Well, that's fine. We should be careful. Number 1, we should be vaccinated. Number 2, we should be careful. Agreed. I wanted to now go over these 2 studies. Again, this is a news cycle. This may be CNN, this may be somebody else as well. So again, I'm not seeing here what CNN is saying or presenting CNN to you as a fact. I'm presenting what the news cycle is doing. And now let's look at the studies. Here is the study, number 1. This is the Qatar study, I believe. Waning of BioNTech vaccine protection against SARS-CoV-2 infection in Qatar. So here they're not saying just the waning of the antibodies. They're saying waning of the protection. And we have done this discussion many, many times, that when antibodies or when the immune system has gone back to rest, It takes some time to wake up and start working. During that time, an infection and even symptoms can occur. So here what is important is effectiveness. First look at this. In the third week after the first dose, the efficacy reached, this is Pfizer, 77.5%. In the first month after the second dose. So sorry, 77.5% the first month after the second dose. And the range is 76 to 78. Effectiveness declined. So look, they're not talking about antibodies declined, of course, those. So efficacy declined. And they have a definition of what do they mean by effectiveness down here. Vaccine effectiveness against SARS-CoV-2 infection was estimated with the use of the test negative case control study design. So they didn't test them, but they looked at the data and pulled that data, which is fine. Now, going back here, they're saying effectiveness declined gradually thereafter, with the decline accelerating after the fourth month to reach approximately 20% in month 5 through 7. So see the fourth month and then declining. And we just read that book as well, which had nothing to do with SARS-CoV-2. It's just immunology book. And that was written before SARS-CoV-2. So they were not influenced by these studies to put that in. And we saw SARS-CoV-1 study from 2017 also talking about fourth month, because it's a normal process. This is why I said if those scientists who are not aware of this, then they should know it. But believe me, these scientists here, they're not saying it because they think they do not know that this happens and they just found something. They're just confirming. This is a good work they're doing. They're confirming with SARS-CoV-2, we are seeing this. They're reporting. Imagine they're technical news reporters. An important thing here is this. Look at this last one. Effectiveness against any severe, critical, or fatal case of COVID-19 increased rapidly to 66.1% by the third week after the first dose and reached 96% or higher in the first 2 months after the second dose. Effectiveness persisted at approximately this level for 6 months for severity. I'm adding the word severity by myself. This is the same paragraph for severity. So there is a clarity here, and that is body is able to take care of the thing. So I've said it many times. If I got vaccinated, my immune system has gone back to rest. I got exposed today. The virus have a chance to become active and start replicating and causing even symptoms if it causes enough damage before the immune system wakes up. But once the immune system wakes up, it's going to try to stop the virus. That is why the severity is controlled. Virus can never cause enough damage because the immune system is going to get up in a couple of days and respond to it. 10 hours to 48 hours. So conclusion, BioNTech-induced protection against SARS-CoV-2 infection appeared to wane rapidly following its peak after the second dose, but protection against hospitalization and death persisted at a robust level for 6 months after the second dose. So if you look at this one, I am actually not worried to say, and this is my opinion, I'm not worried to say this, that, hey, we should rush for the boosters. This is a normal process. Now, I would repeat it. I'll repeat it every time I'll say this. If there is a person who cannot afford to be sick during this window of time when the immune system gets back up, and that person may have a risk that they might become, they die or have severe damage, then for them, boosters are interesting because booster would bring in, ramp up their system for next 6 months again. And so that protects. Okay, so this is Qatar study. So we go back here, December 21 to September 5, 907,763 people received second 2 doses. So about 1 million people. Efficacy, we just looked at it. This is one study. Is there a problem with the study? No. Does this study say go take a booster right away, everybody who had Pfizer? No. But if Pfizer says that this study proves that you need to go take a booster, then we have a dilemma. That would happen again in next 2 months and 3 months and 4 months. You saw on the CNN news cycle took it as or presented it as drops off after 2 months or so. 2 months or so. The sound is coming from Luffy scratching the door. Let me just quickly see what he's doing. I'll be back in 1 second. Okay. So this was actually Kyrie. So back here, 2 months or so. Here, if you see, they're saying 4 months and onwards. However, they said effectiveness against severe, critical, or fatal cases reached 96 or higher in the first 2 months. After the second dose, it persisted at this level for 6 months. Good. So that is Qatar study. Now let's go to the next one. Israeli study. 6 months longitudinal study, 4,868 healthcare workers. So here is that study. As you can tell, I've been doing a lots of homework to make sure that when we discuss it, we see all the data in front of us. So here, whether the increasing incidence of infection is due to waning immunity after the receipt of the second dose is unclear. So this is their curiosity that, hey, there is more infections in Israel. People are getting vaccinated. Is it problem with the vaccine efficacy? So they said, we conducted a 6-month longitudinal prospective study involving vaccinated healthcare workers who were tested monthly for the presence of anti-spike IgG and neutralizing antibodies. So it was a prospective study. They tested them every month. So good study. Results. The study included 4,868 participants, with 3,808 being included in the linear mixed model analysis. The level of IgG antibodies decreased at a consistent rate, whereas the neutralizing antibody level decreased rapidly for the first 3 months, with a relatively slow decrease thereafter. And you must have seen this when I was showing this one. Here, they said this is now SARS-CoV-1 2017. Somewhere over here, they talked about many months or the months after 4th. Somewhere here. I don't have time to bring it up again. So this is the Israeli study. Again, does this study actually say that we have a problem? Look what they're saying. Their conclusion is 6 months after the receipt of the second dose of the Pfizer-BioNTech vaccine, humoral response, that is antibody response, was substantially decreased, which is normal and natural, and it is fine, especially among men, among persons 65 years of age or older, and among persons with immunosuppression. That's what they found. Women actually have a more active immune system. So it is possible that because of their more persistently active immune system, they may have a decline which is slower, which is fine. This is why women have more autoimmune diseases as well. So this is the second study. Does this study tell you that we should just quickly run and get the booster? It doesn't tell me that. Okay, continuing. So then the dilemma. Now I want to show you some news cycles to say that really this is what is happening. Look at this. Duration of antibody responses after severe respiratory acute respiratory syndrome. This is 2007 SARS-CoV-1. And this is what I showed you. Among 176 patients who had severe acute respiratory syndrome, SARS, specific antibodies were maintained for an average of 2 years, and significant reduction of immunoglobulin G positive percentage and titers occurred in the 3rd year. Thus, SARS patients might be susceptible to reinfection after 3 years. Very interesting. So going to the news cycle. I think you may have seen this one, that FDA and the booster, FDA advisors reject Pfizer's booster application, but they voted to recommend a 3rd shot for certain Americans, right? So select group. Now, check this out. Some of the, again, I'm not passing this as a fact sheet. I want us to look at some of the data points here. 4 days earlier, a group of international vaccine experts, including some from the FDA and World Health Organization, wrote in The Lancet that current evidence does not appear to support a need for the booster shots. They've read the immunology books and they are seeing data. I'm being facetious. Then, okay, so that part is done. I want to go to this one. Here, it's not just a Pfizer. Moderna is going to come to the table as well to say we want a booster as well, and then Johnson & Johnson is probably going to come in too. But the FDA's Dr. Doran Fink told ACIP Wednesday that there is no data on the safety or efficacy of mixing and matching vaccines, although UK has that data. Boosting with a dose of a brand of a vaccine that is different from the other. So that was interesting. I want to show one more piece here. Look at this one. Dr. Phil Cross, Deputy Director of the FDA's Office of Vaccine Research and Review, noted that Pfizer was using data that has not been reviewed by experts. So it is interesting that if there is a peer-reviewed data, then FDA says that, hey, it is not reviewed by us. And if it is reviewed by them, not peer-reviewed, then they say, hey, this is not reviewed by peers. So I think both of them are needed. But look at this. One of the issues in this is that much of the data that's being presented and being discussed today is not peer-reviewed and has not been reviewed by FDA. So who was presenting this data? Pfizer. Cross told the meeting of the Vaccine and Related Biological Product Advisory Committee. Look at this. Pfizer Senior Vice President Dr. William Gruber said that analysis included waning of immunity over time. Do you really think that Pfizer actually does not know that the antibodies wane? Or they are actually uncomfortable that why did the antibodies wane in 4 or 6 months? And they thought these should just go on. I My speculation that this is not something that is um, unknown. Look at this book here, page number 9. It puts that out here. And we all, doctors and researchers, immunologists, they have gone through these books. So back here, the reason that I look at this and don't feel great about it is that I think they know it. And when they know it and then they are still pushing antibody waning as a reason to take boosters for everyone, I think that is wrong. And one solution to this is, it for certain people it is necessary, but otherwise the solution to this is to talk with the company and say, if your antibodies, if your product is not able to create a response that is good response, durable response, then there may be a problem with the product. Then maybe we should look at Moderna, Johnson & Johnson, other vaccines, give them a chance, maybe Novavax. Maybe Pfizer needs to work more on it. If Pfizer had a vaccine change for Delta, that would have been interesting. But just antibodies waning is not an excuse to push for boosters. That also does not make me anti-booster. I have been discussing booster with my family, for myself, for my wife. I've been discussing boosters need in general. We have discussed boosters for, I did a video, who needs a booster, in which we talked about who are the folks who need a booster. It is a little, so check this out. It's a little disappointing that there's been very little reporting of the cellular immune responses, the cytotoxic cells, the memory cells, the B cells, the memory helper T cells, and an entire focus on the neutralizing anti-sera, Corilla said, which clearly for the population at high risk is absolutely essential, but for the broad population in terms of their protection, which seems to be holding up well over time, that should be because of adequate cellular immune responses. But we have no indication of that, meaning the data was not there. And we know that FDA then approved the booster, and we know who, and we talked about it separately. Here is the Pfizer CEO. And again, these sites, I am not big on figuring out which site leans which way. I try to figure out, other than the opinion part, the content part, people's statements, and those things. So if this KHN, if they are a bad site, then sure. I just need to pick up some of the messages. For example, here, Pfizer CEO is saying, I feel quite comfortable that we cover it, the Delta virus. Then at the end of July, Pfizer and BioNTech announced findings that 4 to 6 months after a second dose, their vaccine's efficacy dropped to about 84%. Then Borla was quick to promote a third dose after discouraging news, saying he was very, very confident that a booster would increase immunity levels in the vaccinated. So, you know that giving a booster will cause the immune system to ramp up, and in some people, it is necessary. Their exposure, their risk level is higher. We don't want to take a risk to say he will wait for 2 days for their immune system to ramp up. Good, but not for everyone. And if we continue to say, you know what, the vaccine is just not generating enough immune levels or protections, and it just keeps waning, then the vaccine may have a problem. So I hope that the discussion is not. So what is the dilemma here? So the dilemma is this normal, the waning? I think it is normal. I showed you proof. Is the vaccine working against Delta? I think it is. If not, then the vaccine needs to be rebuilt. If it is not working, then the answer will not be in the boosters. Booster has one answer, and that is it would trigger the immune system once again. But if the vaccine is somehow has a problem that it cannot continue to protect for a longer period of time, then 2 months, 3 months, every 2-3 months boosters would be a problem. Should the approval and authorization be rescinded for Pfizer and say, you know what, please do some more data research and figure out what's going on with the product, instead of just saying, let's have more boosters. I'll tell you my opinion. I think there is no problem, neither with the vaccine nor with the waning, and the boosters should be for a limited number of people. That is a normal behavior. Every vaccine would do that. So this is the discussion for today. I'm going to come back for a quick chit chat. I request every day almost to give me some time. I want to take rest. My arm is healing, it's almost there, and I want to give it a rest as well. So I'm going to come back and we will do a quick chit chat. We'll do a follow up to this discussion. Please do me a favor. Please like, subscribe, and share. I can tell you this, that since the YouTube has given a permanent warning when removing Dr. Corey's video, they have, I think their algo does something that it reduces your promoting you as well. Plus all ivermectin videos are gone, so people cannot watch them, and so less sharing of so the revenue from YouTube side is now 1/3 of where it was. So we'll see how it continues to fall and how they continue to reduce the exposure. But anyways, one way you can help is by liking or sharing, not necessary to subscribe if you don't want to have these forever, these discussions as long as I live. But please like, subscribe, and share. If none of them, just like. And if you would like to support this work, then you can buy me a coffee. There is a link in the description, or you can become a patron, or you can use PayPal to support this work. Thank you very much, and I would see you in a few minutes.